Hello physios, I welcome you all to our channel Physio with David. We are back with our next lecture on ultrasound. Topic of interest is the therapeutic effects of ultrasound. So my name is Vijay Kumar and let's get started. First therapeutic effect is soft tissue shortening. Okay. Example is adhesive capsulitis. Adhesive capsulitis. So it is the condition affecting the shoulder joint where there occur the constriction of the capsule of shoulder joint. Okay. So due to which there is a lot of pain and restriction in range of motion. So what will be our goal toward this particular pathology? So our goal will be to increase the mobility. And how to make the capsule mobile? Definitely by heating. So heating is given by continuous mode. So we will use continuous mode. And the capsule is lying deep under the skin. So we will be using 1 megahertz frequency. And this will further make the collagen more extensible and increase the mobility. Next is scar tissue mobilization. Due to any injury when the scar is formed, and if the scar is is not good in a good condition, that is it produce restriction in the range of motion. Restriction in range of motion. Okay, so we need to treat it. How we can treat it? As you have studied in the resolution phase of the biological effect, the ultrasound help to realign the collagen. So it is due to the thermal effect. Definitely the continuous mode is used and the frequency is 3 megahertz. Why? Because scar is occurring at the skin and skin is very superficial. Then soft tissue injuries, there are a lot of example: medial epicondylitis, lateral epicondylitis, sprains, strains and many more. So here in all these injuries there is a inflammation. Okay, and we are going to use pulse mode. Okay, we are going to use pulse mode because it has shown very beneficial effect in researches, and intensity is 1 megahertz for the better therapeutic effect given by acoustic streaming and stable cavitation. Okay, so you need to just explain that pain will be reduced. Okay, how pain is reduced in the pulse mode, all the mechanism. Then bone injury. Okay, we have studied that if we apply ultrasound in the first 2 weeks, it is very beneficial. But if we apply it in the cartilage proliferation stage, in unstable fracture, it may have a bad effect. And here special type of ultrasound is used, which is LIPUS, called the low intensity pulsated ultrasound. Here the frequency is 1 megahertz and intensity is very low, that is 0.03 to 0.15. Okay, so this is the very low intensity as given by the name. Okay, that is LIPUS, low intensity pulsated ultrasound. Also it is known for the diagnosis of stress fracture. If there is any kind of stress fracture and we are applying ultrasound there, pain will be elicited. So help to diagnose the stress fracture. Next is wound healing. So wound can be either superficial or deep. The example of superficial wound is varicose ulcer and pressure ulcer, while deep wound is surgical wound. So here what will be the difference? Difference will be in the frequency. It is superficial, so we are going to use 3 megahertz. Surgical wound are deep, so we use 1 megahertz. And in both of the case there is a wound, okay, which must be in the acute condition, so we use the pulse mode. Okay, so you need to make boxes so that you need to understand how the treatment protocol is going. Then is chronic indurated edema. So in this case the acoustic streaming and stable cavitation help to reduce the edema. Okay, so in the chronic condition we are going to use the continuous mode and frequency is 1 megahertz. Okay, next is the resorption of calcific deposits. Okay, so there are a lot of conditions in which the calcium get deposit in the tendons, and researches have shown that by the application of ultrasound there occur reduction in the resorption which is beneficial, and the exact mechanism is not known. Okay, so resorption of calcific deposit is another therapeutic effect. Next is the repair of articular cartilage. Okay, so in case of injury to the articular cartilage or meniscus, okay, studies show that injury of medial meniscus, okay, it help to increase the growth or the repairing of the medial meniscus. Okay, in the medial meniscus injury. Okay, so here also we are going to use the frequency at 1 megahertz. Okay, then is plantar warts and acute herpes zoster. Okay, so plantar warts is the condition which affect the plantar surface of the foot, and here also there is pain, and its pathology is related to the occlusion of the capillaries. Okay, so here pain can be reduced by the application of continuous mode, and in acute herpes zoster we are going to use the pulse mode for the reduction of pain. Okay, next is compressive syndrome. Its example is carpal tunnel syndrome and tarsal tunnel syndrome. Here also, due to the reduction in the space, there occur inflammation of the structures which are passing through the tunnels, and to reduce that inflammation, again we are going to use the pulse mode at 1 megahertz. Okay, for the better resolution of inflammation, for the prokinetic or the pro-inflammatory. Okay, it is the pro-inflammatory effect. Last is pain. It can be acute pain or chronic pain. Definitely in acute pain we are going to use the pulse mode, and in chronic pain we can use the continuous mode. Example of chronic pain is chronic low back pain. Acute pain can be due to sprain or the strain, and frequency depend upon the depth of the tissue at what it is affected. And what is the mechanism of pain reduction? In acute pain, when we are using the pulse mode, okay, the stable cavitation and acoustic streaming wash out the irritants from the nerve endings which help to reduce the pain, while in the chronic pain, okay, there is a increase in blood flow which help to wash out the irritants and the other toxin around the nerves which help to reduce the pain. Okay, so this was about the therapeutic effects. Let us just summarize that. सॉफ्ट टिश्यू शॉर्टनिंग हो रहा है, मतलब कुछ खास इन्फ्लेमेशन तो नहीं है, लेकिन हमने क्या करना है, टिश्यू की मोबिलिटी को बढ़ाना है. सो कंटिन्यूअस मोड और डेप्थ ज्यादा है तो 1 मेगाहर्ट्ज हमने यूज किया. फिर स्कार टिश्यू मोबिलाइजेशन, स्कार तो सरफेस पे ही है, 3 मेगाहर्ट्ज, एंड कंटिन्यूअस मोड फॉर द reorientation of collagen. Soft tissue injury, definitely the pulse mode and 1 megahertz. Then for lipus, that is the bone injury, it is very low intensity and pulse mode. Wound healing, surgical, it is deep, so we need to have more depth of ultrasound, so 1 megahertz, and here also 3 megahertz. And why pulse mode is used? To reduce the chances of bleeding, because if there is wound, you are using continuous mode, it will increase the blood flow, bleeding may occur. Chronic indurated edema, okay, so here also we need the continuous mode to increase the blood flow so as to reduce the edema at 1 megahertz. Then calcific deposits, so it is a, we can say, part more related to the research. Okay, so researchers have shown that the beneficial effect is produced, okay, that is calcific deposit is reduced, okay, by the application of pulse mode. Okay. Next is the repair of articular cartilage. Okay. So medial meniscus injury has shown a lot of therapeutic effect, and its repair was good when we applied the ultrasound. And then is plantar warts and acute herpes zoster compressive syndrome. To reduce the inflammation of the structures that are compressed, we use pulse mode at 1 megahertz because they are at a depth. Then pain I have already explained. Okay, so this was about the therapeutic effect. In our next lecture we will study about the contraindication of ultrasound. Till then, you keep on studying. Thank you to one and all.